My name is Dr. Jennifer Woodworth, and I'm a clinical psychologist at Neighborhood Healthcare. When I first started considering telehealth, I was a little skeptical about how it would work when with young children and families, because when I meet in the office with children, I typically sit side by side with them, and they like to be somewhat close in proximity. Of course, over the telehealth, you don't have that. You have some different styles or setups that you have to consider. And so when I started using telehealth video sessions with the kids, I realized very quickly that they were really comfortable in front of the camera, and being in their own environment was actually kept them pretty relaxed and calm. One of the things I've noticed with kids who are very comfortable in front of the camera and the video is that they've actually taught me some things about how to interact with them over video. I have some patients who prefer to use the chat box. So I will ask them a question and then they'll respond to me in the chat rather than telling me out loud. And it has really helped with communication where they're not that comfortable saying it out loud, but when I reflect back to them, oh, I see that you answered this way, that they're able to acknowledge that, and then we can continue that conversation. Overall, I've noticed children, maybe up to around the age of 13, love the video, they want to be on video. However, there's a point where they, at 13 and older, they prefer the phone. They like that anonymous, you can't see me kind of vibe, but also that they don't have to be ready in any certain way. So if you call them at 8 o'clock in the morning, they don't have to be dressed, they don't have to be ready to get out the door, but they're still able to talk to you on the phone rather than being on video. I've also worked with several kids on the autism spectrum over video and noticed at first they do not want to be on camera. So mom will hold the camera facing her or dad or any other caregiver. They might even hold the camera facing the couch or something that's not the child. And I've noticed if you give the child their own space and time to come into the frame, they will do it, but it might take a few sessions. So not forcing or it feeling like they have to, but asking questions and they can answer without actually being on the video. So you're hearing their voice but not seeing them, which seems to work pretty well. One of my favorite interventions to really get to know a child over video is to use a scavenger hunt. So many times I will start off with asking them to go and find something that is their favorite color or their favorite food or their favorite toy, and they will bring it and show me in front of the camera. It also allows me to evaluate if they're able to follow directions, if they bring something really close to the camera, or if they sit where they sit so I could actually see the item they're showing, if they're interrupting a conversation that I'm having with a parent. But a scavenger hunt really allows me to get to know the child without them even realizing. And they are able to get up and move around, which often helps in the first session because they might be a little bit nervous as well. So this allows them to not have to sit the entire time. With older children or adolescents that the scavenger hunt might not be applicable, I will use an interview technique, or I will start off a sentence and they have to finish it. And that way it's an open-ended question that they have to kind of think about in order to answer. If they are giving me short answers, oftentimes I'll just kind of switch gears and do like a would you rather. So even though it is a forced choice, it sometimes will lead to further discussion. And sometimes we just got to start off with something silly that really might not seem therapeutic, but in the end it turns out to be more comfortable for adolescents who maybe have not had therapy before. And this is just an icebreaker. At the beginning of a telehealth session, I will often check in with a parent, not only about the child's behavior, what's been happening over the course of time between sessions, but oftentimes with the parent themselves about how they're doing, any stressors that have changed or come on since our last session, and how they're addressing their own mental health needs. Something I've learned in this process is really being able to evaluate the parent's stress level as well as the child. So the entire family dynamic is disrupted when the parent is not doing well emotionally. So talking with the parent about stressors that they have, and if needing to, referring them to another professional if they aren't able to follow through on some of the things that's recommended for the child.